Okay, hello everyone. Thank you for joining us again for our fifth and very sadly our final Dementia Keys webinar. Today we will be answering general questions relating to previous topics we have covered and discussing future care and support needs. Information on the types of community support, who to contact and other practicalities of ageing and care will be also covered. I'll now bring Alexis Sobrano in, who I'm sure you all know by now, a SweetTree's Dementia Service Manager and Clinical Specialist. Hi Alexis, thanks for joining us this afternoon.
Helen, thank you very much and welcome everyone. For those of you who are joining us for the first time, welcome to our Dementia Keys webinar. And for those of you who are joining us again, perhaps for the fifth time, thank you so much for supporting us through this series. And we do hope that you have gotten a lot of great information and that today's session will be valuable for you as well. As Helen said, today we're going to be going over some Q&A from previous presentations. We will be talking about considerations for future care planning and also providing the slides as usual so that you have resources at the end of the session. If you do have any questions, just before I forget to mention, please use the raise your hand function or the chat function to ask Helen any questions that you have, and we'll be happy to answer those as we go. So the topics that we've covered so far over the past 4 to 5 weeks have been about dementia, the common types, early signs and symptoms, the different stages, and where to find support. The impact of the current pandemic on somebody who has a diagnosis of dementia, the impacts of social distancing, maintaining and creating routines, and how to support somebody with dementia through the pandemic and social isolation measures. Managing your well-being as the informal carer, the impacts of COVID on informal carers, our own needs, how to manage stress, and maintaining well-being. Resources and support were also provided at the end of those slides, and if you are interested in receiving any of these slides and weren't able to join us for these topics, Helen can send that out to you after today's session. Last session, we covered unplanned hospital admission and discharge, how to manage unplanned hospital admissions now during COVID-19, and discharge planning considerations. Now, just to reiterate, a lot of the information provided about preparing for hospital admission or potential hospital admission and discharge planning is transferable to when COVID is no longer an issue. Now, I will just pause there for a moment to see if there are any questions related to the previous topics. If not, we'll start discussing future care planning and where to find support for future needs.
Okay, I think if we just start discussing the next bit, Alexis.
So when we are talking about future planning, we're talking about legal planning, environmental home planning, so where someone may want to live, looking at their current home environment and making sure that it is safe and suitable for them now, but also in the future. Looking at formal care and support options, informal care and support, so community supports, neighbors, friends, and family, and really creating a supportive community. In terms of legal considerations, we would like to discuss with everyone today what lasting powers of attorney are. So oftentimes people don't look into this until it may be a bit too late. And it's really important, especially if somebody has a cognitive impairment, to start thinking about this sooner rather than later so that the person can participate in this process. With the lasting power of attorney, finance and health and welfare are separate, and somebody can name different people for each. So for example, you can have one or a couple of family members as the financial power of attorney and other family members as power of attorney for health and welfare, or the same people for each. It's really about naming who would be the best person to handle that for your loved one, how many people, so you can name one person or several people, and if they act severally or jointly. So if there's an order or if everyone must agree when decisions are being made. The powers of attorney documents must be registered with the Office of Public Guardian to be valid. And it's, again, important to do this while someone still has the capacity to understand what they are signing and why they're signing it. It's difficult to get this accomplished sometimes due to somebody's resistance. They feel like they're giving up They're giving up some control. And so we want to make sure that we are doing that earlier in the diagnosis so that people are able to participate and maybe rationalize it a bit easier, and you can have more open conversations about that. If somebody does not have capacity to sign a legal power of attorney document, a lasting power of attorney document, then the second option is to look at deputyship. So deputyship is a legal document that is typically used if the person has already lost capacity to make a lasting power of attorney. And that is a request that is made through the Court of Protection. So there's a step further to go here, where you have to make an application to the Court of Protection to be a deputy for a family member or loved one. Now, what's really important to stress about both the lasting powers of attorney and deputyship, that all decisions must be made in somebody's best interest. So if the person can participate in decisions, even if you have power of attorney or deputyship, that person should be involved in those decisions. If they can't, then we would really have the expectation that everyone is acting in the individual's best interest. So thinking about their preferences, their wishes, how they would want to live their life, what kind of treatment they would and would not have, and keeping that in mind as we make decisions for care. Now, there's a lot of really great information on lasting powers of attorney and deputyship on both the Alzheimer's Society website and also the .gov website, where you can go for a lot of really specific information to have your questions answered about what kind of documents you need, who can execute those documents, and when you may want to look at that. So we will provide that at the end of the session as well. There are some pros and cons to each. So with the lasting power of attorney, if done timely, it really allows somebody to participate in that process, which is quite important for someone to maintain that feeling of independence and control over their affairs. Now, we completely appreciate that it's difficult to have those financial discussions or those health discussions with loved ones. So I think the best way to really go about it is to normalize it and make it something that we're doing perhaps together to plan for the future. Everyone's doing it together. It's not just about the person who is unwell potentially or who has a diagnosis of dementia. You really normalize it as much as possible to make sure that they don't really feel singled out. Other legal considerations to consider is financial planning, such as financial advisors. So that's really looking at future care costs. So if somebody is looking at, do I have the means to live home? What are my assets like, so that I can stretch my assets as much as possible to live the way that I want to live the rest of my life? Now that could be in their own home, in a care home, in a retirement community, whatever really is the best fit for them. You want to make sure that you're looking at how to make that realistic based on somebody's assets. Now, financial advisors typically you want to go to are experts in older adult care planning and looking at that. So we will provide some information about that as well. In terms of benefits, Age UK is a great place to go for information. Their website has a lot of detailed information about a lot of benefits that people are entitled to. For example, the local authority is doing care assessments for people and carers assessments for everyone, so they can't turn anyone away. That's due to the CARE Act. You would get in touch with the local authority social work team and request a care assessment. The care assessment is free, and they would be looking at your loved one's care needs, how they can be maintained in the community, and if there would be any financial contribution from the local authority towards those care needs. There also is a CARES assessment that focuses on the primary carer, and there is a financial element there as well. If somebody meets certain thresholds in income support needed, you can get some contribution as a carer as well. There's personal independence payments for people who are under the age of 64. So if your loved one is under the age of 64, they may be entitled to some financial assistance to have a support worker or a carer come to the home to assist or meet their social care needs. Now, I always recommend looking into that especially for people who are diagnosed with a young onset dementia, to give a little bit of help in getting support at home. You can look at things like council tax breaks, attendance allowance for those over the age of 64. So that would be a financial contribution that's based on somebody's need. So that is not means tested. That's really based on someone's social care need, the contribution. Personal budgets and continuing healthcare funding. Now, continuing healthcare funding is really more appropriate for somebody who's more clinically unwell and needs a bit more medical assistance at home. And that's something that you can ask your GP to look into a referral for, and it would be of a more clinical nursing assessment being done. And finally, there is the element of advanced care decisions, such as a living will or an advanced decision to refuse treatment. So that would be somebody really laying out and having a discussion about what kind of care and support they would like now and in the future. So if they weren't able to communicate on their own behalf, really setting out what kind of treatment they would want, where they would want to live, and some important elements, including end-of-life care planning. So that was a lot of information. I'm just going to pause to see if anyone has any questions.
Yeah, we've just had a question come in, Alexis. Somebody's asking, what happens if there is no lasting power of attorney in place, and it gets to the point where that's not able to be implemented?
Sure. So there are really two routes that somebody could take. It depends on the type of care decision that needs to be made. But there are best interest decisions that can be made. So for example, if you're thinking about where your loved one may want to live in the future, where is the best place for them to live, you can do that as a best interest decision. As long as everyone agrees that it's in your loved one's best interest, then typically you can go ahead with that. Similar to with putting home care in place at home. As long as the decision is deemed to be in the best interest of the individual, typically not very difficult to move that ahead without the power of attorney. Finance is very different. Financially, to act on someone's behalf or to access accounts, you really need a legal document behind that. So if it's too late to do the power of attorney, typically what people do is apply for deputyship, or at times family situations are a bit complex. So even if that can be done, they prefer to hire a professional deputy, which you can do as well. So a deputy can also be appointed by the Office of the Court of Protection, or you can hire a deputy separately to handle finances. So there are a variety of different avenues to go if it is too late: the best interest decision or deputyship.
Thanks, Alexis. Also, go ahead, somebody asked, can you please reiterate the situation with regard to those under 64 years?
Sure. So those under 64 years old are typically entitled to a personal independence payment. It's typically referred to as PIP, and that is some financial contribution to somebody's social care needs. And again, I really recommend looking at Age UK. They have a lot of information about the different kinds of benefits that you may be eligible for, such as the personal independence payments, and how to apply for that.
Great, thank you, Alexis.
Okay. And what I just want to highlight also about the attendance allowance is that you can get direct payments. So instead of the council controlling where that money goes and where it's paid and how it's paid, you can elect to have a direct payment to yourself and then pay providers separately, or you use those funds how you will to assist your loved one. So that also is an option for the attendance allowance. And we do see that a lot, where people have the direct payment and they may use that to contribute towards someone's care needs and then top it up with some private payment as well, depending on what someone's needs are. And there are 2 levels of attendance allowance. One, I don't know the figures exactly, so please forgive me, but there is one that is about 60 something a week, and then one that is a bit more than that. It really depends on someone's social care needs. With the continuing healthcare funding, again, just to stress, that's more about clinical, medical, physical need, and that would be something that would be done through a formal assessment with a continuing healthcare nurse, and you could request that through your GP.
Thanks, Alexis.
Just also to reiterate, I appreciate that a lot of these legal considerations can be very sensitive topics. So if you would like to reach out to us to discuss how to broach these subjects with your loved one and your family members, we'd be happy to do so. It's not something that we're unfamiliar with, and oftentimes we are involved in those conversations to help everyone coordinate those conversations as neutrally as possible. So we'll talk a bit about care and support planning. And when we're talking about care and support planning, we're talking about what somebody needs now and then what they may need in the future. So how to keep them safe and happy and all of their needs met, not only now, but as their symptoms or their disease progresses and as they age. We're looking at care and support assessments that can be done through the local authority, as I explained, or privately. So for us at SweetTree, we provide care and support assessments free of charge. You can always reach out to us to do a comprehensive assessment, and they are person-centered, personalized assessments that look at somebody's physical needs, psychological needs, social needs, personal history, likes, dislikes, routines, and wishes. Now, included in that is really looking at home safety and establishing community support. So throughout that assessment process, we will be identifying the current home environment and what needs to be changed potentially now or in the future to keep somebody safe at home, and establishing a supportive network for everyone involved. And now when we do that, we involve next of kin and other important individuals to the person that we're assessing. That could be neighbors, distant family members, friends, anyone who's really involved in their care network. And connecting yourselves with specialists, support groups, day centers, and different kinds of community support that can tie in different needs, again, such as somebody's social well-being. So maintaining contact with the community and really continuing to be involved in their hobbies and interests as much as possible. We would also look at any next of kin or informal cares and what needs they have and what kind of respite they might need, and plan that along the way. So there are instances where we would help people look at booking holidays or support on a holiday if a holiday is really needed and somebody needs a break. So that is part of the care and support planning as well. And it's really about maximizing independence and making sure someone's well-being is met at all stages. The next thing that you would want to do is explore home care options. And those are local authority home care options and private home care options, as well as privately hired home care options. The important way to differentiate those is that any local authority home care that's put in place or using a private company is CQC regulated. So the Care and Quality Commission will conduct their assessments of each company and then come out with their report. So you can really see how somebody's doing in that care and support, if they're safe, if they're responsive to their clients' needs, and get a very detailed view of how that company may work for you. With a privately hired support worker or carer, you really are the employer, and I'll get into that a bit more detailed in a moment, and we'll look at the pros and cons of each of those. We've discussed before creating an emergency contact form as part of the care and support planning process, and that is really keeping a concise list of important contacts, your loved one's medications, any conditions, advanced directives, important medical information such as immunizations, if they're a wander risk, if they're on a special diet, so that if something were to happen to you, that information is kept somewhere that is accessible and the person could be kept as safely as possible. It's also really handy if somebody has to be admitted to hospital last minute unexpectedly, or even, for instance, if you would like to take a holiday and you know, okay, all of the information is here already. So you don't have to really scramble last minute to get all of that information together. In the care and support planning process, we also look at completing advanced directives and advanced wishes. So that is typically a discussion that we would have during the care and support assessment, really asking people if they've thought about what kind of care and support they want. If they weren't able to communicate themselves, would they want, for example, to be resuscitated? What circumstances they would want to be taken to hospital and not taken to hospital, really having those frank conversations while somebody is able to still have them so that they can participate in that process. We also assess the appropriateness for enrolling in a personal alarm and exploring different telecare options. So really utilizing the technology that's available to us now to help somebody stay home independent as safe as possible, giving everyone that peace of mind that if something were to happen unexpectedly, that we can react to that and the person will be helped to be as safe as possible. And we'll get into what kind of telecare options are out there also later on in the presentation. Another really important part of care and support planning is securing prescription repeats and refills and looking at what kind of medication system works well for your loved one. So there are things such as docket boxes, blister packs, and electronic dispensers that help with medication adherence and reminding people that it's time to take their medication. Securing prescription repeats and refill is really handy. That's one less thing that typically the informal care has to worry about. If you can arrange for your chemist or your pharmacist to have that delivered once a month or once every 2 weeks, whatever frequency that your loved one gets the medication, that's one less thing you have to think about. The docket boxes are something that you would set yourselves. Blister packs are something that the pharmacy sets, and so they set out a monthly or a weekly pack with the Monday through Sunday and the times, which can also help people feel really independent in taking their medication if they're able to still do that. The electronic dispensers are part of a telecare offering, and so those are dispensers that are set to a specific time and they release the appropriate medication at that time. So somebody just has to tilt it into their hand and they can take that medication, and it gives you a little alert as a reminder. And for those people who may have some dexterity issues, the electronic pill dispensers do have some variations to assist people with those kinds of dexterity issues or vision issues. They can be adjusted to tip easily, etc. I will pause there for some questions if anybody has any questions.
Okay, we've got a couple of questions here. Firstly, just jumping back to the lasting power of attorney, so we don't miss this one. And somebody's asked that they say they've got power in place for their husband, but he knows what's what at the moment. So is he still able to sign papers, or does she have to do that on his behalf?
Very good question. The important thing, and I'm very glad someone asked that question because I didn't mention that, the powers of attorney really only come into effect when they have to be used. So if somebody still has the capacity to fully participate in their financial affairs and making their health and care decisions, they should still be encouraged to do that. And so just because you've done the documents and you have registered them with the OPG doesn't mean that you need to utilize them. They're really utilized on a case-by-case basis, depending on somebody's ability to participate in that particular aspect of decision making, if that's dealing with bank accounts or making some kind of big purchase or deciding where to live, what kind of care and support to receive, perhaps medical treatments. It's good practice to really, for everyone to be involved in that discussion, but when it comes down to signing documents, if they do still have the capacity to do that, the power of attorney is not a trump card in that sense.
Great, thanks, Alexis. And also another question about the techie side of the care and support. Somebody's said about how you've mentioned this quite a lot. Do you see this expanding in the future of care and becoming a bigger part of care and support planning?
Yes, I really hope so. I think it's really about people embracing the technology. A lot of technology is already available that is really quite advanced. I don't think that in health and social care, we've been very readily adopting this technology. And we will have actually a slide specific to what telecare options are available. They really should be specific telecare assessments done to create a bespoke package to meet the individual's needs. So it's not so much about replacing that human interaction, it's about supplementing it and helping somebody to stay independent and safe at home with the technology that's available.
Great, thank you.
Okay, so we will discuss some differences between privately hired home care help, council-funded home care help, and private agency home care help. So with a privately hired support worker that's not affiliated with a home care agency or with council-funded assistance, it's really important to remember that you are the employer. And what that means is that you are responsible for training the individual, scheduling, vetting, and any insurance necessary. So that would be making sure that somebody understands your loved one's needs and that they're meeting them safely and appropriately. What it also means is that you're responsible for emergency coverage if that individual is not well or goes on holiday. So if anything happens and there's an interruption in that support, knowing who to call or where to get backup, where to get a replacement, and oftentimes that can be quite stressful. For us at SweetTree, a lot of the times we get last minute phone calls from people that have a private person working for them and they're suddenly unwell, or one of their family members becomes unwell and they have to shoot off, and we're doing a very quick emergency assessment to make sure that we can get care and support in so that person is safe and everyone feels comfortable that that person is going to be cared for at home without interruption in that routine of having assistance. It also means that there's less regulation because there's no regulator. So the CQC does not regulate privately hired help. And there's a bit more flexibility in tasks. So somebody might be able to do a bit more. However, you really need to think about the risk and the benefit of that. So with a regulator being involved, as I said prior, you can really look at a detailed report of how the provider is doing and what kind of care and support people are receiving, and get a really good look into the safety, how the company is led, what the leadership is like, how employees are being treated, really get a good view into what kind of company you are engaging. Whereas if you're hiring someone privately, you really have only to rely on the information that that individual gives you. There is no assessment typically, so if you're hiring someone privately, you're putting the care plan together, which can be a bit tricky and confusing at first. I would say this is a situation that you really have the most control, again, for scheduling, training, vetting, deciding who the replacement care might be if that person goes off sick, but I would say that it's the most headache. You are completely responsible for this individual. If anything goes wrong, it's really all about how you're managing that yourself at home. With council assistance and council home care, the council dictates what company you will use. So you really don't have that much flexibility in what company you will use. And visit duration is typically dictated by the social work team. So what they do is they task out what your loved one needs, and they'll schedule visits based on that contact time based on the assessment. Typically here we see shorter visits are more likely. So let's say 30 minutes frequently throughout the day. So it could be a 30-minute visit in the morning, maybe an hour visit in the afternoon, and another short visit in the evening, typically a bit more fragmented. The assessment is done, however, by social workers and professionals who are working for the council. Bit less control. Typically quality varies very greatly because of the amount of people that are being assisted this way. The caveat here is that you can get direct payments and have a bit more control over how you engage a home care company. So we, for instance, have people who have had a council assessment and are receiving council funding, but they elect those direct payments and they use that money to fund private care, not through the council.
A couple of questions just come through on that point, Alexis. With the privately hired help is, do private carers have to register with anybody or an agency at all?
If it's a privately hired care that you are hiring as yourself being the employer and you're paying them directly, no, they don't have to. Now, there are agencies who do matching, and so they're not regulated care agencies. They're more of a, I would say, the Match.com in the care world. So they're matching a carer who wants to work privately with somebody who's looking for a privately hired carer, but they're not regulated and they're not obligated to do care assessments, etc.
Okay, thank you. And also with the council help, is there any way to choose the care provider if it's through the council, or to make recommendations of a care provider you would like to be used?
If you have an existing relationship with a care provider, they're typically more flexible. I think the best way to get that flexibility if you are working with the council is through those direct payments. So if you do elect to receive direct payments on your loved one or your relative's behalf, you have a bit more control of where to go and how to spend those funds.
Great, thank you, Alexis.
So using a private agency such as SweetTree, we are responsible for everything: training, scheduling, vetting carers, taxes, liability insurance, the carer's pension scheme, any coverage if somebody goes off at the last minute. So you are really pushing all those responsibilities onto the agency. Now, for example, for SweetTree, we have a very extensive interview process, a week-long training process that our carers go through based on what area they're going to be working. So for example, in our dementia service, there's very specific dementia care training that everyone has to go through and pass to become a SweetTree support worker. Same with our learning disabilities team, our brain injury team, and our general home care team. So people are trained based on a niche that they want to pursue professionally. You can still choose who to work with. So just because you're working with a private agency doesn't mean that when we assign you a care worker that that's it forever. Nothing's ever set in stone. So if personalities don't quite match or you want to try a few different people, there is the ability to do that. There are regular care assessments, so we will do the initial care and support assessment, which is a thorough, individual, personalized assessment. And we will monitor how needs evolve over time and revisit that assessment as somebody's needs change. Either they progress in their dementia, for example, or for somebody who's undergoing rehab, let's say for a stroke, as they improve, we're able to adjust the assessment. We see it as a living document. We monitor very frequently how things are going through telephone contact, email contact, really touching base with our clients and their family members to make sure that all needs are being met and that everyone's happy, and see where we can improve and what's going well and how we can carry that on. Direct payments can go towards the cost of private agency care. So you can use funding afforded by the council to fund some private care as well. I would say there's moderate control here, but the most quality. So where the agency is responsible for interviewing carers and bringing them on, you really get a lot of quality through the agency policies and how we are working as a company, but also through the CQC regulation process. So we do undergo our CQC regulation process very frequently. So about every 2 to 3 years, we have that. And then you can see how our, Helen, you look like you're getting some questions, so you can interrupt me. You can look at our historical reports and how we've done over time by looking at the CQC ratings.
And if somebody's loved one has symptoms of COVID-19, will it still be possible to find a carer for them? Will it make it trickier?
No, so for us, I can only speak on behalf of SweetTree in that capacity. So for ourselves, no. If somebody is testing positive for COVID, we have very specific health and safety guidelines in place that have been implemented throughout this period to make sure that our support workers can continue work as usual and be as safe as possible. For example, providing all of the PPE necessary, hand gels, and really looking at scheduling very, very closely to make sure that we are minimizing as much extra contact as we can. and getting people places via taxi, just making sure that people are as safe as possible. So we haven't had any issues with covering clients who have tested positive for COVID. So in home and environment planning, looking at care needs now and again in the future, it's about forward thinking about where the best place to live is going to be for your loved one. Is it home? Is it assisted living? Perhaps downsizing in the community if they're living in a big home and they can't navigate stairs anymore. It's getting a bit difficult to do that. Potentially being on one floor of a home, moving in with relatives, or moving to a care home. So really speaking to whoever's doing that care assessment about what they think the best way forward is and how to start planning that. Looking at the current environment that somebody is living in and assessing for any adaptations required to maximize independence. That initially can be done via home care assessment, and then later, if necessary, by an occupational therapist if required. And looking at a combination of current and future factors. So looking at things such as fall risk, someone's frailty, their functional mobility, so how easily they're able to navigate the house based on how strong they are and what their range of motion is presently. Their spatial perception, so if somebody has a visual impairment or a dementia that affects their spatial perception, looking at that as well. Looking at current routines and accessibility. So really taking a holistic view of somebody's health and well-being and how the environment is impacting on that, and making sure that we can make the environment as safe as possible. Again, that ties into a lot of the telecare discussion that we were having. Have a separate telecare assessment to understand what technologies are available to promote your loved one's safety, independence, and peace of mind for yourselves as well. So with the environment assessment, we're really looking at somebody's functional mobility, their cognition, their prior history. So have they had falls in the past? And if they have they been in particular circumstances, potentially in the bathroom or in the bedroom, at night, during the day, really taking a look at somebody's history and how we can make them as safe as possible. If it is in the bathroom, looking at bathroom adaptations specifically. If it's at night, looking at what's going on at night to make sure that we're meeting their needs and reducing their fall risk and making the environment safe. Looking at things such clinical issues such as frailty. So if somebody is becoming a bit more frail, how we improve their navigation of the home to make that safe. Any routines, if somebody typically gets up at night to use the loo, perhaps we need to look at how lights are coming on, or if they're a bit disoriented when they wake up. And again, accessibility. So how accessible are different bedrooms, looking at things like trailing wires or area rugs, things like that, that we can remove in order to make the environment a bit more safe. Now, we would also be looking at furniture. So we're looking at how adaptable we can make furniture. So if that's risers on a low sofa, or different chairs, a riser recliner, something to help somebody stand a bit more easily, we'd be looking at that as well. And we would lean on the expertise typically of an occupational therapist to make final recommendations, but we can certainly, through the care assessment, assist on looking at the environment and looking at where things may need to be improved now or in the future. Any questions, Helen?
Yeah, I've got one just come through. With limited GP availability at the moment, how would you go about seeking non-urgent medical attention for somebody requiring it?
Sure. So right now, 111 is a great avenue to go for non-urgent medical advice. A lot of the GP surgeries are closing a bit early. So some of our clients, the surgeries open, let's say from 9 a.m. to noon, and then afternoon, you're really relying on the out of hours service. So if your GP doesn't have a specific out of hours person, I would say calling 111 is the best way to go, the best avenue to go to get support. If you have any questions about medical advice or medication questions that you may have if the GP is unavailable. Now, a lot of the GPs are preferring to do a quick phone assessment first. And if needed to go to the surgery.
And when it comes to just had a question about environmental planning, is that the responsibility of the care provider or the occupational therapists?
So if you are having an assessment with a care provider, that should be part of their assessment pack. For us at SweetTree, we do a very thorough environmental risk assessment within our assessment process. And we are looking at somebody's home relative to what their mobility is presently, looking at their medical conditions and their routines. So it really depends where you're going for assistance. Again, if you're hiring someone completely privately, a carer completely privately, then that would be your responsibility to engage an occupational therapist if you feel some improvement needs to be made. The occupational therapist can be really critical in coming in and looking at equipment needs, for example, so a bath lift and things like that. So we would suggest that that is looked into and that an occupational therapist is contacted to make those recommendations and order any equipment needed. So a private agency wouldn't order equipment. We could really recommend what to look into in terms of any formal equipment needed. But other adaptations, such as looking at lighting and looking at accessibility, is really within our remit.
Okay. Another question just come through, Alexis. You mentioned riser chairs. Is there anywhere that you would know that is possible to test them out, with shops being closed at the moment? Would that need to wait until things get back to normal a little more?
Yeah, I would say if it's not urgent and you want to try out a few different riser recliner chairs and purchase that privately, then waiting until some shops are open to have a look is probably a good idea. Otherwise, if you engaged an occupational therapist, they would come and measure and look at your loved one's functional mobility, so how they stand from a chair, look at their leg strength, etc., and they could recommend the appropriate riser recliner.
Great, thank you.
Okay, so we'll look at some telecare examples now. And if anybody has any questions about any of this equipment or anything we talk about with the telecare, again, very happy to have that discussion one-on-one, because it's a very individualized process to go through. Some telecare examples of things that are available presently, for example, would be a flood detector, bed exit monitor, a fall detector, which probably everyone's familiar with, either the neck worn or wrist worn fall detector. There are heat detectors, there are gas detectors, there are panic buttons, really a variety of examples that I could give you that are utilized around the home to keep the home safe. I'll pick up a bit on let's say the bed exit monitor. So if your loved one is prone to getting up at night very frequently and they're a fall risk, you may want to look into a bed exit monitor that alerts somebody when somebody's getting out of bed, or if they've been out of bed for quite a long period of time and that's unusual for them. There are also smart smoke alarms and carbon monoxide alarms, where you wouldn't have to rely on somebody connecting the sound with something being not quite right. So if the smoke alarm or smoke detector and carbon monoxide detector went off, it would automatically send an alert to the local fire brigade or somebody in the vicinity that has been triggered. So if somebody has a dementia and the smoke alarm goes off and they can't connect to the beeping with that event, then the smart detectors would be able to send that alert elsewhere so that it could be responded to appropriately. There are other things such as the flood detectors. So for anyone who is still independent with their personal care and still wants to shower and do those kinds of things independently, there are flood detectors that would monitor if water goes above a certain level and then send an alert or make a noise to indicate that there's a potential flooding situation. Now, for individuals who have a diagnosis of dementia, sometimes that can be really crucial for family members to allow their loved one some privacy and independence, but also that peace of mind that if something is not going quite right in the bathroom, that they can respond to that before it overflows and floods and potentially there is a bigger issue going on. The panic buttons are also quite popular for people who want a bit more security around who's coming to the home. Now, unfortunately, scams have become quite prevalent. So those are typically in place if a stranger comes to the door, that button could be utilized to get help. In that vein as well, we have even more advanced technology such as the Ring doorbell technology that is connected to an app on someone's smartphone that actually takes video of who's coming to the door. So if your loved one is home alone and you're not quite sure that they're completely safe and they wouldn't let a stranger in, or you want to know who's coming to the door, you can look into that as well. Now, again, that is managed through an app on a smartphone. And so if somebody rings the bell, your smartphone gets an alert and you can see who's at the door. It also is really useful for the purposes of implementing home care. And so if you're just looking into home care and you're not quite sure if your loved one's going to let the home care in or let the support worker in, you can see when the support worker has arrived, and you could, for example, call the house and tell your loved one, you know, it's okay, your support worker Mary is here, you can let them in. And so to give them that reassurance as well, that that is safe. For wandering, for example, there are really cool different GPS systems other than the regular watch-worn GPS systems. So for people who aren't used to wearing a watch or will forget to put on their watch, they also make now GPS trackers that can go in the sole of someone's shoe. Now, consent should always be sought before implementing something like a GPS tracker, because you are really technically following someone around at that point. But again, for those who don't want to wear a wrist worn or will forget to put on a watch, the GPS that goes in the sole of the shoe can be quite handy, especially if somebody's wearing the same pair of shoes, you know, or you can minimize the amount of shoes that somebody has. It's really non-invasive way to implement that, and also allows somebody that flexibility and independence to still continue to enjoy the community on their own if they're able to do that. There are also motion sensors that can be placed around the home, and so that would really detect where somebody is in the home and how much they're moving throughout the day. And that can really give us a lot of valuable information about somebody's daily routine. So if you're not sure, for example, if your loved one is eating very much or how much they're moving around the house, if they're just sitting down for most of the day, that's a really good way to get some useful information about what their needs might be if you're not able to be there as much. And then on the back of that, you can put in place other interventions such as, you know, physiotherapy if you notice they're not moving around as much and you're worried about their strengthening and they're not getting as much exercise because they're not going around the house as much. They're not going into the kitchen. You may want to start keeping an eye on their weight. So if you're concerned about are they eating or not, you can implement that as well. There are also door sensors that you can place on doors and windows to see when they have opened. So there's no reason you couldn't put that, for example, on the refrigerator to see if somebody's snacking during the day. Now, just because they open the refrigerator doesn't mean that they're necessarily eating, but that is a valuable data point that would allow you to look into things further if you still had concerns. Now, on the bottom of the screen here, it looks a bit funny. It looks like two locks, one that's open and one that's closed. So there are smart locks now that you can fit onto your front door. And I think this is really useful for people who have a cognitive impairment. So if your loved one forgets their keys, for example, or can't manipulate keys, you can actually remotely lock and unlock your front door through this system, which can be quite helpful. And again, all of this is about safety, but also maximizing independence and helping people to maintain as much ability as they can throughout a cognitive impairment, for example, or if somebody even is undergoing some rehab and you're just wondering how much they're moving around throughout the day because they really should be moving, and not moving around and sitting in the same place all day is putting them at risk for example, a blood clot. you can also use a lot of this to help somebody's rehab process as well. Okay. Any questions about any of the telecare that you see on the screen? Please feel free to ask Helen, and she'll put the question through.
Just got a question about the cost of telecare. I guess that would range quite substantially, wouldn't it, between not a lot and very expensive?
Yeah, it really depends on what devices you're looking into, and if you're looking at privately buying something or potentially going through the council for the fall detector. That's really basic piece of telecare equipment that a lot of the councils will provide. So a lot of the councils have a telecare assessment team. So that's something to look into if your council can provide that. If not, during the home care assessment, if you are having a private home care assessment, it should be something that the assessor is looking into, you know, what can be supplemented, and then they could help you look at where to source that if it's being done privately. And it just really depends on what you need, how many pieces you want, and where you're getting them. Okay. So with all of this, we're really looking at establishing a network of support. So I've used myself as an example, so you see me in the middle there. And the care planning assessment should really look at the individual and what's around them. So what supports they currently have, and then what additional support might assist them both now and in the future in maintaining their health and social care needs. So for example, your loved one may have connection to a GP service that's very reliable and that they have used for a number of years, and that's a really great support, really good family support, neighbors on either side that are very involved and can step in when needed or pop in from time to have tea or maybe to prompt medication. That's really great. Friends and access to transportation. But perhaps your loved one is no longer involved in their hobbies as they used to, or you would like to see how you can expand that occupational time for them and getting them more involved in the community. There may be a need for more specialist services such as district nursing or a specialist nurse, Parkinson's nurse, for example, or a diabetes nurse, so we can assist in identifying those kinds of supports that may need to be implemented. Looking at support groups, so for informal carers, but also for your loved ones, are there support groups that can be tapped into for those support needs? So connecting with people who are in similar situation or to exchange care tips, frustrations, success, and looking into home care options. So this is all part of that future planning for care and support that we would want to be looking into. Again, it's really about looking at the individual, what supports they have in place, and what supports may be necessary either immediately now or at some point in the future. It's really important to get a future view so that you don't feel like you're doing everything in a rush. I always say that it's better to start planning now and at least have an idea of what you may be looking at in the future, so that when it happens, you feel like you have a bit more choice and control in that scenario. You know, of course, people come to us in emergency situations all the time. Someone's had a fall, or somebody's being discharged from the hospital and they didn't anticipate having to look into home care at this exact moment, and that's okay. But it's better if you can do that as a bit of a more of a controlled process so that everybody feels included in those decisions and the transition is done as best as possible. Now, completely appreciate, again, that that's not always possible, but where it is possible, it's always a good idea to get that information and start planning and start thinking about that before it's suddenly sprung upon you, and it can feel quite overwhelming. Any questions or comments?
No, I think you're covering everything beautifully. Nothing through just yet, but please do use the chat box or raise your hand if you've got any questions, anybody at all that you would like Alexis to answer.
Okay, so since it is our final session, I figured we should talk a bit about SweetTree and the kind of care and support that we may provide, and really what makes us different So with SweetTree, we provide free individualized care assessments. And so if you intend to use a private care company now or at some point in the future, it can never hurt to call and to get an assessment. It is free. You would then be able to get a bit more information about how the care process works. Really importantly about SweetTree is that we listen to our clients. And so our assessments aren't ever a one size fits all. We always tailor it to the individual and their particular circumstance. And we really see the family unit and those informal cares as an integral part of the care and support process. And so we look at how we can support everyone. So where the assessment is really focused on the individual getting that care and support, we take a broader view as well of what everyone's views are on what the needs are now and how we can really support the whole family unit. In terms of our staff, they're extremely valued and developed. So we have our own in-house training academy that has been developed over the last almost 20 years at SweetTree. And it's really focused again on making sure that our support workers see their care journey with SweetTree as a profession and helping them progress and gaining more knowledge so that they can expand their skill set as well. We have various employee development schemes and really want to make sure that our employees understand that we're taking care of them just like we would take care of our clients. And so, we really realize that our happy employees translates to happy clients, and then we can provide the best service possible. We have a CQC rating of outstanding, which we are very proud of, and it took a lot of very hard work to get there, and very, very confident that we will maintain that. And what you see is what you get. So if we for some reason, cannot assist you for any particular reason, we'd always be transparent about what we can and cannot do and help you find the assistance that you need. Does anybody have any questions about SweetTree, about the care assessment process, our support work staff, training? Okay.
I think it's important to say that although this is the final session, Alexis and the team are always going to be available to answer any questions you have after today. When I send over the slides, as I have been doing every week, I will include the links to the YouTube videos. So these actual sessions you'll be able to watch back as well as look through the slides. And I'll also include in there Alexis and the team's contact information, so you can contact them directly after this. If there's anything you think, oh, we should ask that, or need some more assistance with something specific, then you can always ask then as well.
Okay, so now is the time really for any questions and comments. I'm going to go back actually to the summary of the topics covered so far. So for anyone that was on any of the other webinars, if you have any questions that you weren't able to ask or you didn't think of, now please ask those questions. Happy to answer from any of those topics or from today, even any unrelated questions that anyone may have about care and support planning. Please do feel free to send them through.
Okay, we've just got a couple come through now, thank you. Would individuals have designated managers when they're assessed, or would there be different managers supporting one client?
Sure, great question. So we do have one dedicated manager per client. And so the person who does your assessment would be your care manager for the duration of your support with SweetTree. And so what that means is that they are supervising your care team and also doing those care plan reviews and reassessments as needed. So you really establish a very good one-to-one relationship with that person. And what's really great about SweetTree is it really is a very close-knit team. And so just because you have that one dedicated person doesn't mean when they go on holiday, nobody knows what's going on. We always arrange backup cover, and people are quite involved and happy to assist each other. So while there is that one person and you develop that relationship, you also have the support of the wider team. Any other questions coming through, Helen?
Yeah, we've just got another one come through. Would I have contact with the office or the managers 24/7, or is it just set working hours that I would be able to speak to somebody if I had an issue?
Great question. We do have a 24/7 on-call manager who is on call out of hours and able to take any questions or deal with any urgent issues that arise either from clients or our support workers. So the on-call manager that's there 24/7 is a resource for the support workers and our clients.
Perfect, thank you, Alexis.
One final comment that I'll just make before we wrap up today is that I know this is a lot of information and future support planning can feel like a really huge task. What's important to remember is that if you do decide to get a formal care assessment, that you will be assisted through that process and it will be made a little bit more manageable for you, and that you have somebody who is a professional who knows the health and social care space that can really guide you and support you through any questions that you might have, but also that you can take it in bits. You don't have to do everything at once. You know, you can be helped to implement things as you see fit. So as you see in importance. So if that's first looking at lasting powers of attorney, and getting more information about that, or what you feel is most important right now is establishing a support network around you just in case there was an emergency, that is something that we can assist you with. Or just getting an idea of what kind of support that is available out there from home care companies, we can also assist you with that. So getting that information and getting that initial assessment doesn't have to feel like a big daunting task for you. You can really look at specific areas and we can help you look at specific areas to address over time.
Alexis, when it comes to reports or notes that the managers or carers are reporting on, is that accessible or is that stored somewhere that isn't accessible?
We take a very person-centered approach in every sense of the phrase. So we do have electronic notes that people can elect to have, where those are accessible via a map form, a portal that we use, where the support workers take those notes and then we are able to see them instantaneously, and family can have access to that as needed. Or if somebody prefers paper notes, we do have a system where there are paper notes in someone's home. And so if that is a preferred way of getting information, that can be implemented as well.
Lovely, thank you, Alexis.
I guess any final questions, please feel free to send them through to Helen. You can always check through our website. Now, I think I've mentioned this in prior webinar sessions, but we do have a really, really great document that you can download as a PDF with a list of questions to ask a home care provider. And so you can really refer there if you're looking into SweetTree or any other company. You can go there for information on what types of questions you should be asking about the assessment process, what you can expect from support, how the support workers are trained, how they are supervised, and really get an idea of how to start those conversations and how to start that assessment process.